examiner asked to examine the ulnar nerve of the patient. Examiner need to introduce themselves and sanitize his or her hands and then explain about the examination that will be conducted to the patient and ask for the patient's consent. Make sure the patient's hands are on the pillow and also make sure there is adequate exposure of the hand up until the shoulder. Starting with the look for any scar along the elbow, medial volar forearm and also the medial wrist. Look at the end for any deformity such as ulnar claw deformity and Wartenberg's sign. Next is muscle wasting. Look for the volar forearm muscle wasting which can suggest higher ulnar lesion, and also look for hypotenar muscle wasting. For the dorsal aspect of the hand, look for any scar, deformity and muscle wasting of the dorsal guttering in case of interossei muscle wasting. Next, do the screening test. Ask the patient to do the OK gesture by extend the elbow, the wrist and extend and abduct the little finger, ring finger and middle finger while flexing the index finger and thumb making a circle. Moving on to the feel. The examiner need to ask the patient for any pain before touching the patient's hand. Next, check the temperature. Following that, check for any tenderness. Touch every joint for any tenderness and swelling. Start from distal phalangeal joint, middle phalangeal joint, proximal phalangeal joint, metacarpal phalangeal joint and wrist joint. Now, move. To test the flexor carpi ulnaris power, ask the patient to supinate the arm and ask them to flex and adduct the wrist while the examiner gives resistance to it. Next, moving to the flexor digitorum profundus, ask the patient to extend the fingers. The examiner need to support the proximal interphalangeal joint and ask the patient to flex the little finger and ring finger while the examiner gives resistance to it. To test the abductor digiti minimi and dorsal interosseous muscles, ask the patient to abduct the little finger and the index finger respectively while the examiner gives resistance to it. To test the palmar interosseous muscles, ask the patient to abduct the finger while the examiner put a piece of paper in between the finger and try to slip the paper out. After that, check the tone of the elbow and the wrist joint. Next, check the reflex of the biceps, triceps and brachioradialis muscle. Now, check for sensation. For that, test it on the patient's chest with the eyes open and ask whether she or he can feel it. Then, ask the patient to close the eyes. Next, test the sensory at the palmar region of the little finger and make sure to compare both sides. If the patient lost sensation at this area, then this is suggestive of lower lesion. Following that, test the dorsal aspect of hypotenar region. If patient lost sensation at this area, then this is suggestive of upper lesion. Moving to the special test, this is known as Froment test. This is to assess the adductor pollicis. Ask the patient to hold a piece of paper in between the thumb and index finger while the examiner tries to pull it out. Positive test is when the patient tries to hold the paper but flex the thumb due to weakness of adductor pollicis. The examiner will end the examination by thanking the patient. Examiner will also end the examination with checking other joints of the arm, other peripheral nerve examinations, and a complete upper neurological examination. To make a diagnosis, it is crucial to include which nerve has been affected, whether it is right or left, complete or incomplete, high or low lesions of ulnar nerve injury.